Back now on Triad Today. Very privileged to have a special guest take some time out from his busy practice and duties. J. Paul, our director, if we can meet a gentleman with a very long title. He wears many hats. Dr. David Meyer is a neurologist with the Triad Neurological Associates. He's president of the North Carolina Neurological Society and chairman of the board of Cornerstone Healthcare. Welcome to you, Doc.
Thank you.
How you doing?
Doing fine. How are you?
Fine. There's some things I want to ask you about headaches and Alzheimer's and things that we really got you here for.
Okay.
But before that, there was an item in the news a few days ago, and I have to get a quick reaction from you. A Harvard School of Medicine study came out and said that people who have smoked for a long time are 73% less likely to get Parkinson's disease. Now, I'm not joking about this. My question is, are we going to start advocating to your patients, hey, go ahead and smoke?
Well, you may have heard Jay Leno's comeback on this, that plus alcohol and sex will help reduce heart disease, Parkinson's, and problems with prostate. The difficulty here is we're talking about what we call descriptive statistics. That is, we can associate some things statistically as if they relate, but not necessarily because there's a cause and effect relationship. When we're doing research studies, we have analytical statistics that tell us whether we've actually accomplished something worthwhile. So this, along with the association of oat bran reducing cholesterol, which is still part of an advertising campaign,
right.
is really one of those things that is an association. And as far as oat bran is concerned, wheat bran does the same job, and anything that has high fiber.
I got you.
So we're talking about something which is interesting and appropriate to discuss, but it's certainly not going to be we're not going to advocate that kind of process.
All right. Now, belated congratulations to you on being the president of the Neurological Society here in the state. Very, very quickly, though, what does that job entail? What are your duties for that?
Well, we have an annual meeting where we get together and share educational experience, and we also advocate for patient processes so that we are providing high-quality patient care. There's some issues where the quality of work done by some professionals isn't what we would want to do.
So you want to monitor
and so
that.
we want to monitor those things as a society and try to provide that kind of quality work that patients can depend upon us to give.
Great. I'm really proud of you for that. All right, let me get to a couple of clinical things I want to get to before time gets away from us. Headaches. Everybody gets headaches. You're a noted neurologist, so help me out on this. How do I know if I get these really bad headaches, I'd either take an aspirin or I think, man, this is severe, I got to go call the doctor?
Well, any headache that happens very, very abruptly, so that there could be a concern about a burst blood vessel, or if there's any other change, such as a sudden loss of vision, difficulty with the use of an arm or a leg, or numbness, should immediately call attention to the need to go to the emergency room and have this evaluated. A headache that is like the one you had last week, but just more severe, doesn't call for that kind of immediate care. But headaches that do have altered vision, are made worse by severe noise around you,
right,
by bright lights, probably is in the family of migraine and could well be treated more effectively than going to your local pharmacy and picking up a bottle of medication there.
Let's talk about Alzheimer's very briefly. And correct me if I'm wrong, there is no cure per se.
That's right.
But are there any particular protocols or treatments?
Well, we currently have several medications in two families of medicine, acetylcholinesterase inhibitors being one group and glutamate medications to do another. These will slow down the process of the symptoms of the disease. They don't actually change the disease itself. We're actually doing some research in our practice on some new approaches in which the breakdown products of brain cells, as they're damaged and as they're being injured, are able to be removed from the brain in the hope that that will actually lengthen the time that a person will stay alive and function. It's very important to us that people not just live longer, but that they have a quality of life while they're living longer.
I want to give a shout out to you and your group, the Triad Neurological Associates. And is there a phone number people can find if they have a question over at the office?
Absolutely. 336-768-6347.
And a shout out, I think on screen, to High Point Regional Health System and to Truliant Federal Credit Union for helping to make these great segments available to the public. Will you come back and see us sometime?
Absolutely.
Thanks, Doc.
Thank you.
All right, we'll be right back after this.